Everybody, today we'll be discussing physiology of ascending tracts. In previous lecture of physiology of spinal cord, we have learned that section of spinal cord divided by gray matter, which is H-shaped, and this gray matter consists of nothing but neurons, neuroglia, and unmyelinated axons. Now this H-shaped gray matter divides the spinal cord white matter in three regions based on the location. Located anteriorly is called as anterior white column, posterior white column, and lateral white column. So these are the three important divisions. Now what is the importance of this? Basically they help us to label our tracts. Tracts are basically columns consist of bundles of fibers called tracts and fasciculus. They are nothing but axons of the neurons. Basically, nervous system is nothing but bunch of neurons with their synapses. Neurons have got the cell body, axons and dendrites. Now axons in the different locations are labeled differently. Outside the nervous system, they are called as the nerve fiber. When they come in the spinal cord, these axons of the neurons, they are called as tracts or fasciculus. When they ascend up or descend somewhere in the brainstem region, they are called as lemniscus. Above in the cortex, they are called as radiation. So basically tracts, fasciculus, lemniscus is nothing but axons of the neurons. So tracts are basically highways of nerve impulse conduction. They are grossly classified into categories based on their direction of impulse transmission. If they are transmitting the impulse above, means from spinal cord to up, they are called as a sensory tract or ascending tract. And if they are carrying the information down towards motor neurons for execution to the muscle, they are called as a descending or motor tracts. Usually we label the tracts based on their position in the white column, their origin and their termination. Now to start with, we'll see the first tract. So this is our part of the skin. From here our sensation will start. So here there is this is the basically spinal cord lower segment. Okay, this is the medulla oblongata. Now from this part of the skin, the nerve which arises and carries the impulse toward the spinal cord, you can see it is having a cell body. This is the axon. Okay, so as it is a first part in the tract, it is called as the first order neuron. First order neuron of a tract. So here you can see it is starting, it is making synapse here with the receptor and ending in the spinal cord. Okay. Now in the spinal cord, sensory relay neuron starts. If you just recall physiology of spinal cord, we have learned sensory relay neurons are there in the gray matter. Now here this is the sensory relay neuron. From here now the fibers are arising. This is the axon. You can see it is now immediately crossing to opposite side at the same segment of a spinal cord. This is very, very important regarding this. Moment the sensory neuron is formed, it is immediately crossed to opposite side. Means from right, fibers are going to the left. Okay. Now these fibers are ascending. You can see they are going in this lateral side and they are going up to the thalamus. So this neuron is called as a second order neuron. So first order neuron is this, that is a sensory nerve. Second order neuron is this, that is arising from spinal cord, crossing up immediately to opposite side and traveling in the lateral part of spinal cord and going up to the thalamus. So this is the second order neuron. So it is ending in the thalamus. Now some more sensory neuron of same tract are arising from same segment of spinal cord, crossing to opposite side, but you can see they are moving in the anterior side of spinal cord, that is anterior white column. They are also ending in the thalamus. So these both are second order neuron, and now as it is arising from the spinal cord and terminating in the thalamus, so this tract will be labeled as spinothalamic tract. It's very simple. It is called as the spinothalamic tract, arising from the spinal cord, crossing immediately at same level of spinal cord to opposite side. That means from the right it is going to the left and ascending up. Some fibers are ascending in the anterior side and some fibers are ascending in the lateral white column. So this tract is called as spinothalamic tract. And now based on their location, again we divide into two categories. Those passing in the lateral side, they are called as the lateral spinothalamic tract, and those going anteriorly, they are called as the anterior spinothalamic tract. So this is called as a spinothalamic tract, arising from the spinal cord, crossing or decussation. You can see in the books the terminology given is decussation. The decussates immediately to opposite side and goes up to the thalamus. So this is the spinothalamic tract. Now from here, again fibers are arising, neurons are here now. Now they are making synapse to the neurons in the thalamus. From here now, neurons will arise and their axons will go to the sensory cortex. You can see here. Now this neuron are called as the third order neuron. Simple. First order neuron is this in the sensory nerve. Second order neuron is the sensory relay neuron, which is going up to thalamus. It is making synaptic connection with thalamus. Now from thalamus, again neurons are arising and they are going to the sensory cortex. So they are called as the spinothalamic tract, first order neuron, second order neuron and third order neuron. Okay. Now their termination in the sensory cortex, this is, we should learn in a good way where they are terminating. You can see in this diagram we have got sensory nerves are there from lower limb, from hand, upper limb, this different region. Okay, from all different regions nerves are arising and they are going in the spinal cord like this. Now from spinal cord obviously this tracts, our tracts are arising and they are going. Now these tracts will end from different, they will end in this region now. So they will go to the respective regions. For example, those arising from the hand, so those arising from the foot, some arising from the knee, some arising from the shoulder. Now they will go to the wrist. You can see in this different regions are written. See, from the hand area the fibers have gone here. You can see the face area, lips, this area, this area. So the sensory fibers are ending in different part of the cortex systematically, but you can see they are in very much disproportion. You can see this is the back of an individual which is almost, I think so, 1 foot, but you can see the lips which is hardly few centimeters. See the disproportion. So this is called as a small human presentation. This whole presentation is called as a sensory homunculus. Homunculus means small man. This is the small man. Small man representation in a disproportionate. Why? It is now presentation is simply based on skill or proportion of skilled work carried out by that part of the body. Our fingers are performing very skilled action. When you write, your handwriting is your identity. You put up your signature. So it is having a very crucial area. So it is having more area. Lips, your movements are there. Your movements are making the difference in your voice and so many things. So this part of the body which is having a more skilled action, they are given more area in the cortex. On the contrary, part of the body, for example, this back, which may appears big one, but it is not having any skilled action. It is just maintaining the body posture. So it is given less area. So this is called a sensory homunculus. So like this, whole body presentation is there in the cortex. So it is called as sensory homunculus. So fibers arising from thalamus here, they are going to different part of the sensory cortex but they will go to the respective regions only. Those arising from the hand, they will go to the hand area only. Those arising from the legs, they are going to the legs area only. Okay, so like this, there is a presentation there in the sensory cortex. So spinothalamic tract, grossly given two categories. Lateral spinothalamic tract means simple, it is going in the lateral white column, arising from spinal cord, ending in the thalamus. And from thalamus, third order neuron are arising and going to sensory cortex. Anterior spinothalamic tract means arising from the spinal cord, traveling in the anterior white column, terminating in the thalamus. And from thalamus again, fibers are, third order neuron fibers are arising, they are going to the sensory cortex. Now they are carrying these sensations from the respective receptor. So lateral spinothalamic tract will collect the pain sensation all over the body. Okay, so it is pain, as if you recall, the receptors for the pain are the free nerve endings. So these fibers are carried by lateral spinothalamic tract. Similarly, temperature sensation is again carried by the lateral spinothalamic tract. Anterior spinothalamic tract is carrying the touch sensation, that is crude touch, touch with force, that is a pressure, alternate touch, and tickle, itch, and sexual sensations. These are being carried by the spinothalamic tract. Now in this diagram you can see this is the part of the skin. From here our first order neuron is arising, ending here, and you can see here our spinothalamic tract, second order neuron going up to here. Now while going up, the spinothalamic tract gives some of the branches to this meshwork of nerve bunch here in the brainstem, that is called as a reticular formation. The name reticular formation means the neurons are scattered like a meshwork. They appear like a reticulum, that's why the name is given. So this is the reticular formation. Some of the spinothalamic tract fibers give some branches to this reticular formation, like these branches are there. Now they will go to the thalamus, and from here they will go to the cortex and activate it. So this is called as ascending reticular activating system, which is nothing but again a part of spinothalamic tract only. You can see in this diagram, this is nothing but spinothalamic tract, fibers coming here, second order neuron arising and crossing the opposite side, going up to thalamus and going here. So this is nothing but spinothalamic tract, but some branches are given to this reticular formation, which will excite this nuclei. They in turns activate the whole cortex. And according to some author, this is labeled as a separate tract called spino-reticular tract. But there is a difference of opinion. Some say it is nothing but a branch of only spinothalamic tract. Some consider this as a separate tract. But ultimately, anatomy of the both is same. First order neuron is ending at the spinal cord. Second order neuron arising and crossing to opposite side, going up to the thalamus. And from thalamus, fibers are going to the cortex. So this is the spino-reticular tract. Now in this diagram from Guyton, they have given the same. You can see from this upper limb, fibers are coming and going to the upper limb area, and from the lower limb you can see the fibers are arising and going to the lower limb area. So like this, fibers from different part of the body will end at the different regions in the sensory homunculus. And here you can see this second order neuron fibers while going up giving some branches here. Now they have labeled this as the spino-reticular tract. Similarly, while going in the mesencephalon, they are giving some branches here. You can see the branches are here. So this is called a spino-mesencephalic tract. But ultimately, main tract is our spinothalamic tract, which is having the main anatomical same, crossing at same side and going up to thalamus, and from thalamus it is going to the sensory cortex. So like this, you can categorize them in three tracts: spinothalamic tract, spino-reticular tract, and spino-mesencephalic tract. But according to some, spinothalamic tract has got the same functions. Now one more very important tract, This is the lower segment of spinal cord. This is the medulla oblongata. Now you can see from our skin, sensory nerve is arising. This is the first order neuron, but you can see without crossing or without taking synapse, it is going up to the medulla oblongata. Okay, so this is the first order neuron which is going on same side posteriorly. It is now making synapse with one nuclei present in the medulla oblongata. It is called as a nucleus gracilis. Nucleus gracilis. That's why this tract is labeled as fasciculus gracilis. So this tract is labeled as fasciculus gracilis. Fasciculus means again nothing bunch of fiber. So this is other name given to the axons of this neuron. There we have labeled them as tract. Now here they are labeling as a fasciculus. So this is see the difference from spinothalamic tract. In the spinothalamic tract, first order neuron was ending here and second was arising from here and traveling to opposite side. But here now, first order neuron is going without any synapse, uncrossed up to the medulla oblongata. Okay, so this is the difference in this one. So now ending here. Now from the upper segment of spinal cord, upper part of the body, for example the head neck region, some fibers are arising. Again same first order neuron without crossing, without synapsing, going up to the medulla oblongata. Now they are making synapse with one more nuclei here in the medulla oblongata, that is called as a nucleus cuneatus. So this tract is called as a fasciculus cuneatus. So these two tracts are there, fasciculus gracilis, fasciculus cuneatus. They were discovered by scientists Gall and Burdock. Based on this, they are also called as tract of Gall, tract of Burdock. Okay. So now in both of this, first order neuron is going up to the medulla oblongata uncrossed without any decussation up to medulla oblongata. Now this nuclei both are, now these are the second order neuron. From here now their axon will arise. See, they will now cross to opposite side. They will decussate and goes up to the thalamus. Okay. And from thalamus they are again going to sensory cortex. From nucleus gracilis as well as from the nucleus cuneatus also. Fibers are going like this. So this is the first order neuron of both, which is going up to medulla oblongata. These are the second order neuron which is crossed and going from medulla oblongata opposite side to thalamus. And this is the third order neuron which is arising again from thalamus and going up to the sensory cortex. Now this at the brainstem, or this is called as medial lemniscus. See, nothing but again these are fibers from nucleus gracilis and cuneatus only, but here we are labeling them as lemniscus. As they are located medially, they are called as medial lemniscus. So these are all nothing but axons. Here they are labeled as fasciculus gracilis cuneatus. Here they are labeled as medial lemniscus. In total, this is called as a dorsal column tract. Why? Because it is going in this dorsal white matter. Spinothalamic tract we have seen they are going in the lateral and anterior white matter. Now this is going in the lateral, posteriorly or dorsally. So it is called as the dorsal column tract, also called as fasciculus gracilis, fasciculus cuneatus. Similarly, they are ending just like spinothalamic tract went in all areas like this from respective part of the body. Here also they are having same body presentation in the sensory cortex. This is also called as sensory homunculus. So same presentation. Now but difference comes here is that this column which is going dorsally has got a more special orientation in sensory cortex as compared to the spinothalamic tract. So the dorsal column system high degree of special orientation of the nerve fibers with respect to origin. The anterolateral system has much less special orientation. Reason is that because they are carrying very important sensation for the life. So this is the dorsal column in your Guyton. Same, you can see fibers, first order neuron going up to the medulla oblongata, nucleus gracilis, nucleus cuneatus. So based on this, they are labeled as fasciculus gracilis, fasciculus cuneatus. Okay. Now this dorsal column tract, also called as medial lemniscus system, same name, also called as posterior column tract as it is going posterior white column. Also called as fasciculus gracilis, fasciculus cuneatus, also labeled as tract of Gall, tract of Burdock. Their functions is basically fine touch with a force, that is called as a pressure. Combination of touch with pressure means if anything is kept in a hand, we touch it and press and try to feel the object, that is called as stereognosis. Alternate touch, that is called as a vibration, and proprioception, that is a position sense. So see, these are the important functions carried out by the dorsal column tract. This is the again dorsal column tract. Now the same nucleus gracilis, nucleus cuneatus, fasciculus gracilis, fasciculus cuneatus. Now some of the fibers from here go to this cerebellum. Same, you can see fibers are rising, going uncrossed, going up to the nucleus cuneatus. Now they are going to cerebellum. So dorsal column tract, some branches are going to cerebellum, but some authors label them as separate as spinocerebellar tract. Now this cerebellum is very important center for body position. It is a motor coordination center. It will receive the body position. Based on that, it will decide what actions to be done. So the proprioception function is basically the function of spinocerebellar tract. Some author label it as a separate tract and some as a function of dorsal column tract only. So ascending sensory tracts are basically two: spinothalamic tract and dorsal column tract. In spinothalamic tract, two categories we have learned: anterior and lateral. But according to some author, spino-reticular tract is a separate tract. But we have seen that anatomically it is same, crossing at same level in spinal cord and going up to thalamus. But while going there, it is giving some branches to reticular formation. Dorsal column tract, it is having the function of touch and proprioception. But according to some author, proprioception is taken by the spinocerebellar tract. So here you can see in this diagram from your textbook, you can see this touch sensation going uncrossed up to medulla oblongata, from here crossing to opposite side, going up to thalamus, and from here it is going up to the sensory cortex. So this is the dorsal column tract, and here you can see arising from here, ending, making synapse. Other sensory relay neuron arise from here, goes up to thalamus. Okay, from here synapse. So now you can see clearly in both of this one. Here the first order neuron is uncrossed, going up to the medulla oblongata. Here first order neuron is ending here. Second order neuron arise and cross, say, up from immediately in the same segment and going up to the thalamus. So we will know the importance of this level of crossing when we are discussing regarding transsectional spinal cord. When a patient comes with injury, there you will see classical difference. For example, a patient comes with injury here. There is damage somewhere here. So what will happen now? Patient is getting injury on the left side. But what will happen? He will have a difference in the sensation on right side. He will have some loss of sensation of the right side of touch and pain and temperature. On the contrary, if the patient is having damage here, he will have same side loss of touch. So this will be learning during transection of spinal cord. Just giving a clue now what is the importance of learning level of crossing and different order neurons. Now for you must read from your textbook of Physiology Guyton, characteristics of signals transmission and analysis in the dorsal column or middle lemniscus system, and read characteristics of transmissions in the anterolateral pathway. Now this finishes with the physiology of ascending tract. I will be giving you text material to read from the physiology of Guyton. Then tomorrow we'll have a discussion on the Zoom on this topic. Thank you.